The COVID Conspiracy 101, Episode 4. We're going to talk about Sweden. So here's the difference in what Sweden's doing compared to most of the rest of the world. They have listened to their epidemiologists and their head medical team and used the rationale that they're going to try and push through it, doing some social distancing things, limiting it, but trying to get to the herd immunity status without overwhelming the hospital systems, which in a sense is what the point of lowering the curve is, and what most of what I thought the rest of the world was doing, but lowered the curve and then kind of stopped. So what they're doing over there is why their deaths have been a little higher, because they're not trying to lower the curve as much. They're trying to kind of let it happen. And their theory is if they don't push back as much, pull back as much like everyone else did, their patients, they're going to get infected, and they're okay with that. They've accepted that. They've had a lot of their nursing homes get hit really hard, which everyone in the world has too, but they're especially. So lots of deaths from that, but their theory is, well, just because we have more deaths on the front, when you look at their numbers compared to other countries' numbers in 6 months or in a year, they're going to look very similar. So their deaths are going to be on the front. You know, that curve is going up and then down, while the other countries are trying to get this lower, drawn-out curve. So they're accepting it that it's not worth shutting down their whole economy to lower the numbers on the forefront when it first happens. So they're basically accepting the fact that there's going to be more deaths up front, in theory that it's in time their numbers will average out to be not statistically different than other countries while maintaining their economy. They're having a lot of people getting laid off there too, furloughs, things like that. So they are having that. The primary schools are still going to school. Middle school is still going to school. They did cancel high school. So I'm guessing they're more okay with the younger the children, the more they want them exposed. They're limiting things to 50 people gatherings, last I looked last week. So that's where they stand, and you can't say one way or another whether it's working, you know, because they're having statistically some more deaths than other countries early because they're doing it differently. And you can't really say they're in the long run going to be better or worse because we don't have the data that to compare that to down the road. So just so you have a heads up as to what Sweden is doing differently. And it's a conspiracy because people want to say we should just do that, or other countries should just do that, and we don't per se know, but true science is more so probably on their side as far as statistical difference at 6 months, a year, because just because you have the deaths early, that curve is still relatively going to be the same size. It's just not drawn out. And if they're not losing more people because of the hospitals being overwhelmed, then essentially the same people in that curve are going to pass away than the drawn out curve. And they save their economy for the most part. So you can look at it and say, well, could we have done that here? I don't know. To be determined. We're going to have to do that now. So essentially we're starting, basically not starting from scratch, but close to it. So we have to do something different, or else we're going to be sitting here in lockdown for a year till we get a vaccine. That ain't going to happen. So we got to start pushing.